Good morning. I am Dr. Malik. Today we will talk about an important topic, particularly uh, diabetes and fatty liver. Diabetes and fatty liver. See, they are like twins. Diabetes and fatty liver are like twins. You get diabetes, you will get fatty liver. If you are already having fatty liver, you are going to get diabetes. So diabetes and fatty liver are like twins. So you get fatty liver, you are going for diabetes, or if you are a diabetic, you are already having fatty liver, or you are going to get fatty liver. So this is an important entity. What is fatty liver? What is diabetes? They are nothing but just like twins. Okay. And what is the reason for these twins? What is the reason for these twins? Hyperinsulinism. Hyperinsulinism. What is hyperinsulinism? High flow of insulin in the body. That is, the pancreas is working like anything. Pancreas is working round the clock, or it's working heavily to produce very high levels of insulin, in the body. And this high level of insulin, which is flowing in the body, is not sensitive. The body is not sensitive to this particular insulin. The body is resistant to this insulin. It's not working. That is the thing. So what happens is, slowly with hyperinsulinism, you will get diabetes, you will get fatty liver. So hyperinsulinism means high insulin flow in the body. That is, your body is containing very high insulin. Nowadays, not only HbA1c, fasting blood sugar, post-lunch blood sugar, you can evaluate even serum fasting levels of insulin, or anytime insulin you can get checked. So that test is also there. So one thing is, once you are developing hyperinsulinism, so naturally there is diabetes, there is fatty liver. Once there is fatty liver, see, when do you call it fatty liver? If 5% of fat is normal in the liver, see, if the liver, which is 1500 grams, contains 5% of fat, it is normal. If it is more than that, then if it goes to 10% and above, it is called grade 1. Next grade 2, next grade 3, grade 4. Grade 4 is almost 60% to 70%. That means by the time the liver is totally damaged, it is getting fibrous. That means it is almost tough, stiff. And next is cirrhosis. The cirrhosis means liver is no more working, and it has to be replaced. That means transplantation of liver. That's the only way. So liver cirrhosis can happen in three conditions. Alcoholic hepatitis, we call it alcoholic steatohepatitis, that is ASH, alcoholic steatohepatitis, non-alcoholic steatohepatitis. These are the two things. In non-alcoholic steatohepatitis, you get infective steatohepatitis also, infection, HbA1, hepatitis. There are 5 types of hepatitis, viruses. There are 5 types of viruses which cause infection of liver. That is A, B, C, D and E. Okay, there are 5 types. We'll discuss it later. The only thing is, there are 3 types. One is alcoholic steatohepatitis, non-alcoholic steatohepatitis. Among the non-alcoholic steatohepatitis cases, you have infective one, and the other one is fatty liver. The other one, fatty liver causing the cirrhosis of liver. Fatty liver causing the cirrhosis of liver. So what happens when there is fatty liver? Initially, the gallbladder stones also will form, because this is liver, and this is gallbladder. The bile which is produced in the liver is slowly, it will be stored inside the gallbladder. If the bile which is produced in the liver is having high fat content, naturally it will be thick, and there will be sludge, and there will be stones inside the gallbladder. So that is what happens. The stone tendency will increase with fat. So fatty liver secreting bile, more chances of having this gallbladder stones, because all the bile is stored in the gallbladder before it is transferred to the intestine for digestion. So from there, see, the fatty liver not only causes gallbladder stones, it causes atherosclerosis, because all the sugar from the body, all the sugars, excessive sugars which you have eaten in the body is taken up. All the digested food which ultimately forms glucose. This glucose is taken up by the excessive glucose is taken up by the liver and stored inside the liver as fat. Why? Because suppose suddenly you are on fasting, suppose you are fasting for 3 to 4 days or 1 or 2 days, or a hunger strike or something like that. From where you are getting the energy? From the liver. The liver fat stores, they again form glucose and give you. This is a reverse process. Okay, so that is how the liver acts. So from there, from the liver, if the fat is going on increasing, if the liver is containing lot of fat, slowly that fat is given to the arteries, body, every organ, arteries, and inside the arteries there will be clots because of this fat, cholesterol, triglycerides, again they form fat. This fat will be transported to the vessels, blood vessels, and all the organs in the body, adipose tissue, that is, the fat tissues in the body, visceral fat, fat everywhere in the body is coming from there again, and it gets deposited in all the adipose tissue, fat tissues, and most importantly, all the blood vessels, including the heart blood vessels, will have those small plaques, that is triglyceride and cholesterol are getting lodged there. So slowly the arteries are getting narrowed, and there you are going to get MI, that is heart attacks, strokes, that is brain strokes, and cancers also. For example, liver cancer, where is it coming from? First, the fat which comes, the fat which is completely completely gets studded in the liver. Slowly the liver cells are damaged, they get fibrosis to cirrhosis to cancer, liver cancer. Ultimate thing is liver cancer. Not only liver cancer, other organs cancer, everywhere cancer is also related to this, is also related to fatty liver, because the fat is getting deposited everywhere, and it is destroying the tissues. Okay, so we eat two types of food. Basically. One is high glycemic index foods, low glycemic index foods. High glycemic index foods, low glycemic index foods. Here again I stress on, what are you supposed to do? 80% your diet, 80% your health depends on your food, 20% on your exercise, So please, exercise is a must. If you are not doing exercise, you are not putting any effort to do exercise. So like walking, cycling, sit-ups, push-ups, I have been telling you. One day walking, cycling, other day sit-ups, pull-ups. So that push-ups and sit-ups one day walking. For some people, if they have any knee joint pains, cycling, exercise or cycle at home is the best. But walking is also a good exercise. You will get exposure to the sun. By that you can form vitamin D and all. You get vitamin D from sunlight. Our skin manufactures vitamin D when it gets exposed to sunlight. That is also good. But only thing is, if you have knee joint pains, etc., and if you are not residing in a safe place for walking, cycling is the best. That is, exercise or cycle at least half an hour to 45 minutes per day. And the other day, alternate days, you do one day walking and or cycling, the other day push-ups and pull-ups. These are sit-ups and pull-ups. That's what I say. Push-ups and sit-ups, we say. Okay. The food content, high glycemic index foods, low glycemic index foods. What are the high glycemic index foods? Generally what we are eating is high glycemic index foods. For example, wheat, rice, sugar, jaggery and maida. Jaggery which comes from sugarcane. I am talking about jaggery which comes from sugarcane. I am not talking about jaggery which comes from palm tree, because it is safer. It is safer. But this jaggery which is coming from sugarcane is very dangerous. So these are high glycemic index foods. Why I am talking about high glycemic index food is, the moment the food enters the stomach, this is the stomach. The moment the food enters the stomach, see, what does the stomach do? Stomach does nothing. It doesn't absorb except alcohol. Stomach doesn't absorb anything. So stomach is it is like a mixer grinder. It churns the food. It's like a mixer grinder. Then the food enters the small intestine. Inside the small intestine there will be digestion. For example, this liver which is producing bile is stored in this. This bile gets released in small intestine. Not only bile, and this pancreas we all know it secretes insulin, but it has got other functions also. It secretes lipase, it secretes amylase. These are all the enzymes, and multiple enzymes. See, we have so many bacteria inside this gastrointestinal tract. From mouth to anus, you have nearly about 1,000 varieties, 1,000 species of bacteria, 1,000 species of bacteria, viruses, fungi, whatever you call them, to digest your food, and they are your friends. You are digesting food. It is not your greatness, it is the greatness of your bacteria also. So they produce so many products, so many enzymes to digest the food. So amylase, lipase from pancreas, bile from liver, and so many things, so many other glands are also, we call endocrine glands or exocrine glands. Exocrine gland is one which has got tube. And for example, liver has got a tube, call it exocrine. Pancreas is endocrine because it doesn't have a tube to flow the secretions. There is no tube. So no tube containing things are endocrines. Tube containing glands are exocrine. Okay, whatever it is. So in the intestine, the food gets digested by the bile, by the amylase lipase which is produced in pancreas, and most of the bacteria which cause so many enzymes. The only thing is, if you are taking high glycemic index foods, like rice, wheat, jaggery, sugar, maida, etc., what happens is they get quickly converted to glucose. They get quickly converted to glucose in the small intestine, and this glucose, which is excessive, because see, after the glucose is formed, the glucose has to move into the body cells. The glucose has to move into the muscle cell, into the brain cell, into the skin, into etc., whole body, into the liver, etc. For the glucose to enter the body cells, into the cells, it has to go inside the cell and act, isn't it? So once the glucose is produced, to enter the cell, it needs insulin. Insulin is needed. So because high glycemic index foods, they convert into glucose very fast. The pancreas, it is at a great risk. It is almost like the pancreas is given such an orders that it twists, it secretes heavy insulin. That is where the pancreas gets damaged. So suddenly, in very small time, just 1 hour to half an hour, or maximum 2 hours, all the high glycemic index foods are converted to glucose in the small intestine, so that high insulin is needed, heavy flow of insulin is needed. So this insulin transfers this glucose into the cells. Excessive glucose which is there, suppose you are eating 4,000 calories, you need only 2,000 calories. Rest of the 2,000 calories, what happens? That excessive 2,000 glucose, that 2,000 calories glucose which is there in the intestine, which has formed in the intestine, is taken up by the liver and stored inside the liver as fat. That is how the liver fat forms. So the glucose is converted to fat by the liver and it is stored inside, and at the same time from the liver it goes to the fat tissues in the body also. For example, you have visceral fat which is there around the stomach and intestines, and so much of intestine fat around the muscles, fat around everything, fat around the waist, etc., etc. So this fat, why this fat, this glucose is converted to fat, is suppose you are fasting, you don't get food for about 7 or 8 days. This fat which is there in the liver and other organs or other tissues, adipose tissue we call it, it gets released into sugar. That's what. That means it is again converted back into glucose and given to the body. This is how the function of the body goes on. So high glycemic index, they destroy the pancreas very fast, because daily heavy work to the pancreas. For example, you take low glycemic index foods like millets or fats, proteins, they are low glycemic index, because they, and vegetables, all the non-vegetarian food, they take times to convert into glucose. They take time. They get slowly converted into glucose in the small intestine, so that the pancreas is given a less job. Pancreas is not given a heavy job to work. Pancreas works slowly, comfortably, like a white collar job. It doesn't get strained, so that there is no hyperinsulinism. But one more danger: suppose you get low glycemic index foods, you take more quantity. Suppose you need 2000 calories, you can eat 2500 calories. But if you eat 4000 calories food, suppose you eat the food double than what you require, what happens? Again that gets converted to glucose, and again the same fatty liver complications, because food is excess in the body. Though the pancreas works slowly, it has to work for longer time. Because you have consumed more food. That is the problem. So the only thing is from the liver only. See, the basic thing is, if you are consuming cholesterol, triglycerides, that is fat, protein and carbohydrates, it doesn't directly affect you. You see, they get converted to glucose. And this glucose which is in excess, it is stored in the liver, and from the liver it flows into the all the blood circulation, and where these fat stores, that is small blocks, form in the arteries. It is from the liver, not directly from the intestine. So if you are eating triglycerides, if you are eating cholesterol, it doesn't mean that it directly goes and gets lodged in the arteries and you get heart attacks and all. No, it is not like that. They convert it to glucose, they go to the liver, they form fat, and from there you are getting these problems. So the thing is, please try to take low glycemic index foods like millets and all vegetables, non-veg, especially any non-veg can be taken, any non-veg curry can be taken. Vegetables, you can take plenty. All these things, they have low glycemic index, but don't take this high glycemic index foods. They are dangerous. So they get and in moderate quantity, low glycemic index foods also in moderate quantity, so that always keep some place in the stomach. So when you are eating, don't eat stomach full. Give some space, leave some space, so that you don't eat full, so that you don't feel, and you don't strain your liver or your pancreas. This is how it happens. So be cautious, because nowadays fatty liver almost every third person has, and sometimes even every alternate person has fatty liver. And fatty liver ultimately causes the fatty liver causes diabetes causes fatty liver, and ultimately this fatty liver is the reason for your heart attacks, your strokes, whatever it is, and cancers, liver cancer. Most of the cancers are coming from this. And one more thing is, so the thing is, at a very young age, people are landing in heart attacks because of fatty liver and diabetes. Diabetes and fatty liver, they are not different, they are just twins. They are just twins. You must understand.